On Thursday, August 11th, I was woken up by a phone call. When someone takes their own life, it's a different feeling. You don't get mad at them. It just fills your head with questions. You just wonder what you could have done. To look at it and say, oh, this is just another depressed teenager, this is just someone going through a hard time. If you can't treat the problem, then the problem's just gonna get worse. You need to do something about it.
I manage the crisis line and I do the training to prepare people to volunteer on our crisis line. And when you've got somebody and you are talking to them in crisis, you can establish a lot in a 10 to 15 minute call. We've had kids as young as 9, 10 call the crisis line.
My main job involves coordinating mental health checkups for youth. And then we also offer education and awareness programming and do postvention for schools that have lost a student to suicide. The idea of these checkups is really to connect people, first to identify the youth, and then to get them connected to resources. We're just trying to offer them an array of resources that might be useful for them. Suicidologists have identified acute risk factors, which are immediate, and those are called the warning signs. And these warning signs, there are several of them. A change in behavior, thinking about suicide, anger and irritability, substance abuse, isolation or withdrawal. If a youth is struggling or is in pain or having thoughts of suicide, this is something that's really heavy. It's a heavy burden for a person to carry by themselves. There's help out there.
I think there's always hope, and I think there's an answer other than suicide.
Life, it isn't what people make it out to be sometimes. It's not about image, it's not about success. It's hard, but it's not about any of it. It's just about living life and just enjoying it.